Kia ora and welcome to our educational webinar series on irritable bowel syndrome, or IBS, and the low FODMAP diet. This is the first webinar of two to support you on your journey with the low FODMAP diet and FODMAP reintroductions. My name is Nicola Winter and I'm a New Zealand registered Mātanga Kai or dietitian at Te Whātua Health New Zealand Southern, specialising in gut health. I'm a local and I've grown up here in Otepoti and now live in Waititi with my partner and two children. And today I have my colleague Esme McCoy with me, and I'll let her introduce herself.
Ko Esme toku ingoa no Ireland in Scotland o ku te puna, kei te noho o ki Otepoti. So I'm Esme, I'm from Dunedin, I work at Well South, which is a primary health organisation. I'm also a local, I grew up here, but I did my Masters of Dietetics in Auckland.
Thanks, Esme. We've actually just recently designed our service for patients diagnosed with IBS because we had quite a large number of referrals and really long waiting times. So now we have patients in the southern region working closely with their primary care team, implementing basic IBS strategies, and then these educational webinars are provided to support you on your journey. Because this is a new process, and we'd really grateful if you could fill out some feedback so that we can evaluate how effective it is for our patients. This is consisting of a survey before you start on the low FODMAP diet and a follow-up one down the track once you've completed it and done the reintroductions after the second webinar. Would be really appreciative of this. So, what are we going to cover today? I'm just going to give you a bit of an overview. And really we're going to talk about what irritable bowel syndrome is, what you need to consider before going on to the low FODMAP diet, what the low FODMAP diet is and exactly how to follow it. We're going to talk through some example meal plans and debunk some common misconceptions about the low FODMAP diet. And we'll also provide you with some information and resources on the low FODMAP diet so that you feel well equipped to move forward and begin implementing this in your day-to-day life.
So, what is IBS? So we have a short video to play which explains what irritable bowel syndrome is, also known as IBS.
IBS is a surprisingly common gut disorder that affects 1 in 7 adults. While we know that some people are more likely to be affected than others, such as women and people aged less than 50 years, we still don't know the exact cause. Reassuringly, there is no inflammation or intestinal damage in IBS. But the symptoms of IBS can have a major impact on daily life. So, what are the symptoms of IBS? Abdominal pain, diarrhea, constipation or a mixture of both are usually present. And other symptoms may be present, such as bloating, distension and excessive flatulence. These symptoms can vary quite a lot between people. Some people may suffer mostly from constipation, others may suffer mostly from diarrhea, and others may find their symptoms switch between the two. Sometimes they may be constipated and sometimes they may be troubled by diarrhea. These changes can be unpredictable, which makes living with the condition a bit harder. But one symptom that is common among all people with IBS is abdominal pain. The pain can be crampy, sharp, stabbing or dull, and can last minutes or hours. The pain may be relieved or made worse by passing a bowel motion, or it may be linked to a change in bowel habit. One theory regarding the cause of IBS is that there are problems in the way in which the gut and brain communicate. The gut may be overly sensitive, whereby normal changes in pressure during digestion may be perceived as pain. Likewise, people with IBS also often find that stress and anxiety can trigger their IBS symptoms. While there is no known cure for IBS, there are many effective therapies that can help to reduce the symptoms. These include prescription medications, over-the-counter medications such as laxative, fibre supplements and peppermint oil, exercise, psychological therapies, and diet therapies.
To summarise what was said in the video played, IBS is a functional gut disorder that affects the function of your large bowel. It's a condition that needs to be diagnosed by a GP or gastroenterologist based on the Rome 4 criteria. The Rome 4 criteria is up on the slide, and it is recurring abdominal pain on average for at least 1 day a week in the last 3 months, and is associated with 2 or more of the following criteria. Number 1, related to defecation. Number 2, associated with a change in frequency of stool. Number 3, associated with a change in appearance of your stool. It is a chronic relapsing condition which may be improved by diet and lifestyle modifications. Unfortunately, the exact cause is not fully understood, and it is thought that there are many different factors associated with the onset of IBS. Even though the cause is not understood, we do understand it has significant impact on your quality of life, and we are here to help with that. So what is important before trying low FODMAPs for IBS? So following on from the previous slide, we're going to discuss why it's important to have a diagnosis before trialing a low FODMAP diet. As part of the process of diagnosing IBS, your GP or gastroenterologist will look for red flags. These include unintentional weight loss, rectal bleeding, family history of bowel cancer, unexplained iron deficiency, nocturnal symptoms, so any symptoms routinely waking you at night or need to open your bowels overnight, your age at the time of diagnosis, and considerations we need to take if you're over 50 and experiencing these symptoms. They will also do other screening tests to rule out any other bowel conditions. These tests include fecal calprotectin, celiac screen, full blood count, iron studies, and CRP. Considering everything we just discussed, it is really important that you have been given a diagnosis of IBS by a GP or gastroenterologist before trying a low FODMAP diet, as it could improve your symptoms and therefore delay in you seeking medical attention for something more serious than IBS. This webinar is only suitable for those that have a formal diagnosis of IBS by their doctor, and it rules out any other causes of the symptoms you're reporting. If you have a diagnosis and have any of the red flags we've just talked about, we recommend another visit with your GP or gastroenterologist to ensure they have thoroughly explored all other reasons for your symptoms. So following on from the previous slide, what's important before trying low FODMAPs for IBS? A low FODMAP diet can be time intensive and requires significant changes to what you are eating. Your gut is generally more sensitive when you have IBS, so trialing basic strategies could help and are more simple to implement compared to a low FODMAP diet. So what do we mean when we say trialing basic strategies? This involves first line advice, which includes eating regular meals, being mindful and chewing food well, reducing gut irritants such as caffeine, spicy foods, alcohol, and high-fat foods, ensuring you have adequate fibre and fluids in your diet, fibre coming from vegetables, fruits, whole grains, legumes, nuts and seeds, being physically active regularly, and trialing a probiotic and possible medications to help with pain and trapped gas. There is good evidence suggesting that even these basic strategies can improve IBS-related symptoms, so at this stage you should have been given the first line dietary advice from your GP and work through this advice with your health coach, and they have referred you for further management. If this is not the case, I suggest pausing the webinar here and meeting with your GP to discuss the IBS health pathway, as first line advice is an important step towards improving your condition.
Thanks, Esme. So now we're going to look into what's important before trying the low FODMAP diet. So there's a few really important things to know before trying the low FODMAP diet. The first one is that up to 75% of people see an improvement in their symptoms, but this also means that 25% of people don't see an improvement with this, and this is even if they follow the low FODMAP diet strictly. Rest assured, this isn't actually your fault, and obviously the diet doesn't work for everyone, and it's not suitable for everyone, as some people find it a bit challenging. The second thing is that stress is recognised as a main trigger of IBS related symptoms, and it's also a very normal symptom. If you think about prior to an interview or a work deadline, some people might get a bit of an upset tummy or some diarrhea, and mild symptoms is okay. but evidence does show that people that really get their irritable bowel syndrome symptoms triggered by stress may not respond as well to the low FODMAP diet. So other treatment options are worth exploring, either instead of the low FODMAP diet, or prior to, or after. These options include some medications, or cognitive behavioural therapy, or even hypnotherapy, and all of these have good evidence bases to support them as methods for treating stress-related IBS symptoms. Again, the last thing to highlight is that we would have some concerns about certain groups of people following the low FODMAP diet, and the groups of people we really, I guess, have some concern about are those with a low BMI, so a BMI less than 18.5, and this is because it might promote some unintentional weight loss. Another group is people that are vegetarian or vegan, and this is because it limits your intake of protein sources, vegetarian protein sources, and therefore we just worry about dietary adequacy, due to the FODMAP content of these protein sources. And another group is those that have either previously diagnosed eating disorders or just sort of anxiety around eating in general, because obviously following any diet really increases the focus on food. So it can be sort of exacerbated on the low FODMAP diet, and we wouldn't want that either. So if you do fall into one of these categories, we recommend getting some one-on-one help from a dietitian to follow the low FODMAP diet, as it may increase your risk of a nutritional deficiency or exacerbate anxiety around food. And so recommend speaking with your GP and hopefully getting some one-on-one advice with the low FODMAP diet if this is you. So now we're on to who the low FODMAP diet is actually for. We've already talked about IBS, how it's diagnosed, and the different treatment options. And so now we just need to highlight who it's actually for. So the low FODMAP diet is for those who have a confirmed diagnosis of IBS from either their GP or gastroenterologist and a significant history of these symptoms, including any of the following: bloating, wind, abdominal pain, diarrhea, nausea, reflux, gurgling, or any combination of these. And they've already worked with their health coach in primary care and trialled the basic strategies for IBS, and they've had a minimal improvement in their symptoms or no improvement in their symptoms. And I just wanted to highlight that you need to have some significant symptoms in order to see an improvement on the low FODMAP diet. We really believe that they need to be impacting on your day-to-day sort of quality of life to be worth trying the low FODMAP diet, is we do know that some mild symptoms of a bit of bloating or a bit of wind every now and then is actually quite normal and actually a sign of a really well-functioning gut. So if your symptoms are just a bit mild, you get them every now and then, but they're not that bad, then maybe the low FODMAP diet isn't appropriate. But when your symptoms are quite constant, a few times a week, maybe you have to take days off work or they're limiting you doing activities you like to do, then that's when it might be worth trying the low FODMAP diet and see if we can improve your symptoms.
So we're going to go over some questions to recap some of the important points we've gone over so far. Question 1. What are the red flags for IBS? The red flags are listed on the slide, and hopefully you could list some, if not all of these. Again, if you're experiencing any of these red flags, you need to have another discussion with your GP before continuing with the low FODMAP diet. Question 2. Who is not suitable to follow a low FODMAP diet? Hopefully you guys chose A, B, and D. Answer C would be those who are appropriate to try a low FODMAP diet. Question 3. What percentage of people are likely to respond to the low FODMAP diet? Answer is D, 75%.
So we've been using the term low FODMAP since we started this webinar, so I guess it's really important to clarify and explain what FODMAPs are. So FODMAPs are certain types of carbohydrates that are found in healthy foods, and that's including in fruits and vegetables, breads and cereals, dairy products, and some protein foods. And if you have a high FODMAP diet, it doesn't necessarily mean you eat the wrong foods or you have a poor diet, it just means you have high levels of these carbohydrates in your diet. So FODMAPs itself is an acronym which stands for fermentable, which means broken down by bacteria in a process that releases gas, oligosaccharides, which are carbohydrate molecules made up of 3 to 10 sugar units joined together. And examples of these would be fructans and galacto-oligosaccharides, disaccharides, which again are carbohydrate molecules made up of 2 sugar units joined together. An example of this is lactose. Monosaccharides, which is a 1 sugar unit. An example here is fructose. And polyols, which are the sugar alcohols, and these include sorbitol, mannitol, and xylitol. These are often found in artificially sweetened products and also fruits and vegetables. So what's different about these types of carbohydrates, you might be thinking? Well, essentially they're poorly absorbed, and that's what leads to them being problematic in people with IBS. Now that we understand what FODMAPs are, it's important to understand how FODMAPs give us symptoms. So firstly, there's another video here that's from Monash University that nicely explains how FODMAPs give us symptoms.
Medically diagnosed irritable bowel syndrome, known as IBS, is difficult to treat and overcome, in part because we still don't understand its precise cause. However, researchers at Monash University have been studying the dietary factors in food that can trigger IBS symptoms. This research has shown that the pain, discomfort, and daily disruption caused by IBS is triggered by certain types of carbohydrates in food called FODMAPs. Here we can see some examples of high FODMAP foods. To understand how some foods contribute to IBS symptoms, we need to look inside the intestines, where food is broken down and absorbed. Zooming in to the molecular surface of the intestinal cells, we see they are covered in molecular machines that accelerate the breakdown of carbohydrates. Most carbohydrates, once broken down, can be absorbed through pumps on the surface of your cells. However, some carbohydrates are not digested or absorbed by people. The rapidly fermentable short-chain carbohydrates that can't be absorbed are called FODMAPs. The presence of FODMAPs causes water to be dragged into the small intestine. Also, because they aren't absorbed, FODMAPs travel through your gut to the large intestine. When bacteria in your large intestine get access to FODMAPs, they use them for energy to survive. The bacteria rapidly ferment FODMAPs and produce gas as a result. Excess gas production and water retention causes the intestines to expand. When the intestinal wall stretches from distension, the highly connected nerves around the intestines send signals to the brain. People with IBS have very sensitive intestines, so these signals contribute to the pain they experience. To reduce FODMAP intake and to alleviate the distension, bloating and other symptoms of IBS, Monash University have developed the low FODMAP diet.
So from this video we can summarise that the indigestible FODMAPs, those groups of carbohydrates we discussed, pass into the large bowel as we can't break them down. This change draws water into the gut, which is by a process called osmosis. Bacteria also use these carbohydrate units for energy, which results in fermentation, and that produces gas. This leads to gas and water retention, and that leads to the bowel expanding. And collectively, these processes lead to the symptoms of pain, bloating, and changes in your bowels. One thing to note is that this takes a significant amount of time. It can take anywhere from 6 hours to 24 hours after ingesting a food for it to arrive in the large bowel where all these processes take place, and FODMAPs can cause these symptoms. This means that you can't think at 1 o'clock after lunch at 12 that you've had a reaction to a food at lunchtime, because obviously that food's not in your large bowel yet. This makes it a little bit difficult when you're trying to figure out things that trigger your symptoms, and that's also why it's important to think of other non-dietary triggers, including stress, physical activity, medications that you might be taking, supplements you might be taking, or things like lack of sleep. So we understand what FODMAPs are now and how they give us symptoms. So what is the low FODMAP diet? Essentially it involves 3 steps. The first step is that we remove all the FODMAPs for a period of 4 to 6 weeks. Ideally we do this with a food and symptom diary prior to starting it, and then again for the last week to evaluate what change we've had in our symptoms, if any. A food and symptom diary can be done the old-fashioned way with pen and paper, and there's one that you can see on the screen now. And it can also be done in a number of apps, including the Monash University Low FODMAP app, which I'll walk you through further on in the session. The reason it can be good to track your symptoms is that when you live with chronic symptoms, it's hard to identify an improvement in them sometimes. We don't expect that you're going to be 100% better and never get symptoms, but we do expect that they should improve. And another piece of advice would be that it's quite useful to use a scale sometimes when talking of your symptoms. So 1 to 10, 1 might be minimal or no bloating, and 10 might be very firm, bloated, painful tummy. Another thing would be if diarrhea is a main symptom, then sort of keeping a record of how many times you open your bowels in a day, and seeing if the number of times you open your bowels changes before doing the low FODMAPs and afterwards as well. If you've done the low FODMAP diet and taken those FODMAP containing foods out for 4 weeks and seen no improvement at all in your symptoms, we would recommend trialling it for a little bit longer, the 6 to 8 weeks. And if you've had no change after 8 weeks, it's really unlikely that you're going to respond to the low FODMAP diet, and you do need to start reintroducing some of those FODMAPs back into your diet, because this low FODMAP diet really isn't designed for long term. The second step of the low FODMAP diet, after you've done your 4 to 8 weeks on the low FODMAP diet, is to test your tolerance to FODMAPs. Basically, it's unlikely that you can't tolerate all of the FODMAPs, so we want to figure out which ones might be giving you the worst symptoms, and if you can tolerate small amounts of them, or if you have to keep some of them really low. By doing these challenges, you can figure out what portion sizes of FODMAP containing foods you can have in your diet long term. This is really the focus of the second webinar that we'll take you on that journey. And then the third step, once you've figured out your tolerance, is really to personalize it to you and liberalize your diet as much as possible so that it's as varied as possible within the limits of your FODMAP tolerances. Keep your symptoms at a level that's tolerable, but ensure you can eat as much variety of foods in your diet as possible. And just a disclaimer, in terms of the low FODMAP diet, it really can take a long time, anywhere from 4 weeks on the low FODMAP diet to 4 to 6 months of doing re-challenges, depending on how quickly you can do them, how much you get affected by them. For example, some people like to do most of the initial challenges on a weekend day so that if they get symptoms, it's not affecting them at work. This obviously significantly slows down the process. Again, we'll talk about this in the following webinar in more detail. So we know what the low FODMAP diet is, and we need to take out FODMAPs from our diet for at least sort of 4 to 6 weeks. But where do we find FODMAPs? So fructans are found in things like garlic, onions, wheat, and some nuts. Galactans are found in things such as lentils and legumes, and lactose is found in mostly our dairy products, and often more liquid products than the harder products like hard cheese, for example. Fructose is found in a range of fruits and also in honey, and the sugar alcohols or the polyols are found in a range of fruits and vegetables, and any sweeteners that end in the artificially sweetened products generally. It's also really important to understand that a lot of foods contain more than one FODMAP, so that's why we exclude all of the FODMAPs initially and then figure out which ones are causing problems by doing these controlled re-challenges or reintroductions. That's really the only way to work out which FODMAPs are giving you symptoms and give you the best, most liberal diet in the long term. What does removing FODMAPs look like? So on a low FODMAP diet, we have foods that we need to exclude. And you can see here a resource that shows high FODMAP foods on the left-hand side and low FODMAP foods on the right-hand side, and it's broken down by food group. So essentially, if you were planning to have dinner with one of those high FODMAP foods, you'd really want to switch it for one of the low FODMAP foods from the same category. So just looking at the first one there, if you were going to have artichokes in your dinner, it'd be preferable to switch it to something like aubergine rather than having gluten-free cornflakes, for example, because we want to swap similar foods with similar foods as they give us lots of good other properties like vitamins and minerals. So if you're taking out a vegetable, we really want to replace it with a vegetable. If you're changing your toast for breakfast, we really want to switch it for a gluten-free low FODMAP toast rather than having something completely different. It's also really important not to cut out full food groups on the low FODMAP diet. We still want to meet the Ministry of Health guidelines for healthy eating, which is 4 to 6 serves of your breads and cereals, and a serve would be sort of half a cup of rice or pasta or a slice of toast, 5 serves of veggies and 2 serves of fruit, 2 to 3 serves of dairy products or dairy replacements, and ideally these would be calcium fortified, as that's a really important nutrient we get from your normal dairy product, and 2 serves of protein foods, so that's your meat, fish, chicken, eggs and dairy. And one really important thing that we get from our breads and cereals is fibre, and so when you're trying to choose a low FODMAP replacement for something like a bread, we do recommend that you still choose something that's going to provide you with some fibre. So you can see now there's 2 options of bread there, and if you're looking at the per 100 grams column and you're shooting down to where it says fibre, you can see that the one on the left, which is the gluten-free, dairy-free white Vogels, has 2.3 grams of fibre, whereas the gluten-free, dairy-free 6-seeded bread has 3.6 grams of fibre. So this would be a far better selection, and this would just be what we would recommend to general people, you know, a whole grain, higher fibre bread, not gluten-free when they weren't on a low FODMAP diet. So that's not different to the general population. And like any dietary changes, I think the most important thing to focus on is what you can have, not what you can't have. So yeah, this resource, I guess, you know, you can quickly swap things out that are similar, or you can look at the right hand side and build some meals around that. And yeah, we've got a few other resources that we'll talk through now to show you exactly what the low FODMAP diet might look like for you.
Now we're going to talk about removing FODMAPs, which is the first step of the low FODMAP diet, and I'm going to talk you through a few resources which might be useful to use on that first phase of the low FODMAP diet. So these handouts are downloadable alongside the webinar. The first is this resource from Te Whatu Ora Waitaha, which is Canterbury, and it provides some background information on what we've already covered, such as what FODMAPs are and what is the low FODMAP diet. It also has tips on following the low FODMAP diet and reminds you about the basic strategies for IBS. The most important part of this resource, or most helpful part, is the next section, which has all of the food categories on the left hand side, and then it has a traffic light system for green being low FODMAP and to have plenty of, or eat liberally on the low FODMAP diet, orange to be an orange level of FODMAPs to have mindfully and in small portions that are specified here, and then red, which are the high FODMAP foods, which essentially we want to minimise and avoid as much as possible on that strict 4 to 6 weeks on the low FODMAP diet. It goes through all the food groups, and presented this way, it really encourages you to select things from the green categories and replace those in the orange and red categories from the green categories, so we're replacing similar foods with similar foods. And then keep going down, and it's got some example breakfast, lunches, dinners and snacks, as well as drinks on there.
So this here is the Monash University Low FODMAP Diet app, and here on the menu screen there are about 6 things I'll talk you through briefly. The first is on the left here, the food guide, and this is where you will look to find foods that are suitable on the low FODMAP diet. As you can see, it is ordered by food group, and you can also look at it by country. Basically, when you're in here, the foods have either red, green or orange colours, and that's similar to a traffic light, green being low in FODMAP at that portion size, orange being medium in FODMAP, and red being high in FODMAP. So whilst on the low FODMAP diet, it would be recommended that you basically eat green, you minimise the orange, and you don't have red levels of any foods that contain FODMAPs. You can also search in here to find something specific, and it will come up and take you to that food category. So the next thing here, top right, is the FODMAP certified brands, and so these brands here generally have at least one low FODMAP product on the market. Some of these are available in New Zealand, but not all. Find a dietitian is where you can find yourself a Monash University trained dietitian, and there is a New Zealand section here. These would be private-based dietitians that you would be looking to see if you required support following the low FODMAP diet. The next category is the recipe section, which has recipes in different meal categories, breakfast, main meals, etc., etc. And these have been tried recipes rather than recipes that might not work out, as some modifications to low FODMAP might make the recipe a bit more difficult. This booklet section here is where you can find additional information on irritable bowel syndrome and FODMAPs. And finally, this diary down in the right-hand corner is a place that you can record your food intake, your symptoms with different scales here. When you're doing reintroductions, even if you don't use it for a food and symptom diary, I would recommend using it because it makes it really easy. It gives you the options you can use and tells you the portion sizes for the different day re-challenges you're doing. We'll talk you through this in a bit more detail in the second webinar. You can also put additional notes in here, as well as your stress levels, which we know can impact on your symptoms and your bowel motions. It's really handy to keep everything all in one place to refer back to, so you can compare how things are going on the low FODMAP diet compared to when you weren't on the low FODMAP diet. Anyway, I definitely recommend downloading that app and having a wee look around it now to get familiar with it prior to moving on with the webinar. Hopefully that walkthrough of the app was useful to show you how to use it and provide some additional information on the low FODMAP diet. Now we're moving on to label reading for FODMAPs. So we've talked about the big sources of FODMAPs. I've suggested to switch to gluten-free breads and cereals to avoid certain fruits and vegetables, avoid things like garlic. But what about hidden sources of FODMAPs? It can be helpful to be a little bit familiar with label reading, as this is the place that FODMAPs can hide. On the right-hand side of the slide here, there are two ingredients lists below each other, and they both have underlined words in them. And the underlined words are essentially those that would be potentially FODMAP containing. So the first one contains apple juice concentrate, which would be considered a high FODMAP ingredient. I put this label up because it actually states that it's gluten-free, but it's just to highlight that not all things that are gluten-free would necessarily be low in FODMAPs. So it has no wheat fructans, which is one of the FODMAPs, but because it's got the apple juice concentrate, it's not necessarily low FODMAP overall. The second contains a few things underlined there: pear fruit juice, apricot pieces, and pear juice, all of which are FODMAP containing ingredients. The advice that we give is that if it's not in the first three ingredients, the FODMAP content is likely to be low, even though it's got a high FODMAP ingredient in it, and the product could be consumed, but in small doses. We can't be certain though, because everyone responds differently. If you're really struggling with ongoing symptoms on the first few weeks of the low FODMAP diet and have a few products where there's a high FODMAP ingredient in the fourth or fifth ingredient, it would probably be worth being a bit more strict for the short term and trialing to get them out and see if that improves your symptoms. So if we apply that rule to these two labels, the apple juice concentrate we mentioned, which would be high FODMAPs, actually the fourth ingredient. So potentially in a small dose it would be okay, but again, if you were someone that had ongoing symptoms, we would be thinking about pulling that out and seeing if that changed your symptoms at all. Hopefully this makes sense, as it is a bit complicated. I think it's about time to have a few more recap questions.
Thanks, Nick. So now that we know a little more about FODMAPs and how they give us symptoms, we have some more questions to go over. So question 4, select the incorrect statement from below. Answer is B, FODMAPs are unhealthy and we should avoid them long term if they give us symptoms. Why this is incorrect: FODMAPs are actually found in lots of healthy foods such as fruits, vegetables, dairy and protein foods, and we don't need to avoid them. The aim is to find individualized levels of tolerance to provide symptom relief so that we aren't restricting lots of different foods in our diets. Question 5, which label is low FODMAP? So it's the blue packet of crackers at the bottom, the Countdown brand, the original flavour. In the other products, it is the garlic powder, onion powder and milk products that make them higher in FODMAPs. Question 6. What serve of the following is considered low FODMAP? So with these 4 foods, I want you to see if you can figure out from the app what a low FODMAP serve is. You may need to pause the video to do so. So the answers are 1/10 of an apple, it's a low FODMAP serve, 1 tablespoon of milk, half a cup of kumara, and a 1/4 cup of quick oats. So now we're going to go on to what you might be able to eat. So we've talked about IBS, what FODMAPs are, a low FODMAP diet, but you might be thinking, what can you actually eat? We're going to run through a few examples of meals and snacks that would be low FODMAP. You might not like all of these ideas, and that's fine. Maybe they will provide some inspiration for your meals and snacks. So first we have breakfast examples. So we've got porridge, remembering that less than 1/4 cup of quick oats uncooked is low FODMAP, plus some low FODMAP fruits such as strawberries and blueberries at less than 5. And we've got some toast, gluten-free or low FODMAP bread with poached eggs, as not all gluten-free bread is low FODMAP, and ideally choosing a grainy bread to increase your fibre intake, as previously said on the label reading slide. Some lunch examples. So these are just normal lunch ideas, just tailored to be more low FODMAP. These are balanced and healthy meals that include all food groups, so that's whole grains, healthy fats, protein, fruits, vegetables, and dairy or dairy alternative products. And then next we've got dinner examples. As onion is a common base for a lot of dishes, you could switch this out for leeks. And for the spaghetti bolognese dish, you should check the flavours in store-bought sauces or sachets, as you may be better off to flavour yourself using tinned tomatoes with herbs and spices, or you can buy pre-made low FODMAP sauces, such as the example on the slide. And lastly, we have snack examples. So this is just going over some snack ideas. With the small handful of nuts, you can use the app to find out appropriate amounts of different nuts. So for hazelnuts, that would be around 10. And there's just a few other ideas listed on the slide. Hopefully you are now feeling more confident with FODMAPs and where to begin in regards to following a low FODMAP diet. And with the help of the accompanying resources and app, you should be able to draft up a shopping list to get started on a low FODMAP diet.
I thought an important part of the low FODMAP dietary education is providing some information about common misconception or confusing points which come up when discussing and following the low FODMAP diet. So the first thing is gluten-free versus low FODMAP. So gluten is a protein that's found in wheat, rye and barley, and the wheat fructans is a FODMAP that's found in wheat-based products. It's obviously found in healthy foods like we've talked about before. In irritable bowel syndrome, it's actually a reduction in the wheat fructan or the FODMAP in that food that leads to an improvement in a symptom. It's not a reduction in the gluten. Some people get confused and they think that by seeing that improvement in their symptoms on gluten-free products means that they have celiac disease or a gluten allergy, but actually it's minimising that wheat fructan that's likely to be improving your symptoms. And don't forget that we've talked about before that not everything that's low gluten-free will be low FODMAP. For example, a gluten-free muesli that's full of dried fruit or nuts won't necessarily be low FODMAP, and a gluten-free scone from a cafe that's got onion in it is obviously not low FODMAP either. So the second thing to think about is food allergy or food intolerance. So a food allergy actually involves the immune system, and the symptoms can be life-threatening. It only takes a tiny bit of the food, like a crumb or even just contamination, to induce symptoms. And so food intolerances don't involve the immune system, and often we have a level of food that we can tolerate without getting symptoms, whereas if we had an allergy we wouldn't be able to tolerate any. And we just need to remember here that we discussed it being anywhere from 6 to 24 hours from food entering your mouth to being in your large bowel where the FODMAP reactions occur. So that we need to take into account when we're thinking about foods and what the symptoms they're giving us. And the third thing I wanted to talk about was dairy-free or lactose-free. So basically the main sugar in dairy products is lactose, but not all dairy products have lactose either. So hard cheeses don't, whereas liquid products such as milk and yogurt do. If you had an allergy, you'd be required to be dairy-free, and you wouldn't be able to tolerate small amounts of cheese or small amounts of yogurt without getting symptoms. So therefore, if this is you, it's likely that you have a lactose intolerance, which is one of the FODMAPs, and therefore switching to lactose-free dairy products is generally the best suggestion, because this still provides us with good calcium levels, which is important for our bone health, and that's a really important property that we get from dairy. If you don't tolerate, I guess, the lactose-free versions, or you don't like them and you want to try dairy alternatives, that's fine, but you do need to make sure you choose one with calcium added to it to meet that nutrient need.
If you do feel like you can't tolerate the lactose-free versions of dairy products, then the next best thing to choose would be a calcium-fortified dairy replacement, as calcium is a really important nutrient that we get from dairy products for bone health. So hopefully that's covered any burning questions you've had about the low FODMAP diet, and you're sort of feeling like you're getting ready to start on phase 1 of the low FODMAP diet. And I'll just hand back to Esme for a little bit more information before we wrap up.
So on the slide we have some more resources that provide more information on IBS and FODMAPs, and some more recipe ideas which will be available for you to access. And this is the end of the first webinar, so hopefully you learned some practical strategies to help manage your IBS symptoms, and hopefully you can now start on the low FODMAP diet and tune in a few weeks to hear about the re-challenge phase and how to work out your trigger foods to enable you to have autonomy and self-manage your IBS. Good luck and see you next time.